Happy Independence Day to all my countrymen. Today we will see this case which was a complication because of a posterior polar cataract and we managed it. And this is the other eye of this gentleman which shows a similar cataract which is yet to be operated. This is in a higher magnification and these cataracts are known to have a defect in the posterior capsule at the center, and as a result this gentleman, which when was being operated for phacoemulsification, developed a posterior capsular tear and the surgery was converted into a small incision cataract surgery, but the surgeon was unable to manage because of the vitreous prolapse, so it was referred to us. And now we can see that we are clearing the remaining cortex, and this is an important step because in vitrectomy view is everything. So clear view is needed before we proceed further. The purpose is to find if there is any dropped nucleus or nucleus remnant in the vitreous cavity and excise it and remove it and then plan to implant a IOL. Now I'll mention here that this kind of vitrectomy needs pull and cut. So you need to have a dual linear switch by using which you can switch from pulling to cutting on fly. Now this is staining the vitreous with triamcinolone. It's very important to create a PVD in these cases, as if PVD is not created later on, macular pucker and ERM forms because of the cortical vitreous. So we can see the PVD has been created and now the retinal surface is bare with no cortical vitreous. Once the PVD has been created and the cortical vitreous has been released, we would like to remove the peripheral vitreous as much as possible. These steps have been completed and now the posterior chamber IOL is being implanted in the sulcus, as the posterior capsule has a large defect, and more so the anterior capsular excess is reasonably small to support the IOL. So this is a single piece hydrophobic IOL which I have been using for implanting the sulcus, though this may not be in agreement with a majority of consensus, but I have found these working well for these eyes and they don't cause any problems as mentioned by few people. This is the patient next post-op day, and patient gained 6/9 vision in coming week, and the final picture at 4 weeks showed everything in place, IOL nicely centered. Thank you.